Panchajanya, the divine conch of Bhagavan Sri Krishna, which was blown during Kurukshetra, indicating the start of Dharma Yuddha that followed. There, all the efforts were done for the establishment of Dharma. Dharma was kept over a personal relation and motives. Keeping the same motive in our mind, our organization will work towards establishing the importance and necessity of following and imbibing the Bharatiya culture, accepting our roots and making people realize the true essence of Ayurveda, not only as a treatment modality but also as a way of life, all this while walking the path of Dharma. Hence, the motto is Shreyam Bharatiyam Arogyam Ayurvardanyam. The founders of organizations started this because we felt the need to spread the knowledge of Bharatiya culture, Ayurveda, the true history of Bharatarashtra, and value to all Shastras of people in every corner of the world. Also, the founder being a Ayurveda aspirants, knowing the inside out of the today's medical field, hence they aim to make the people aware of this and also try their best to solve this on the go. With this aim in mind, I would like to welcome you all to the Pragnavaridhi lecture series conducted for second year students. Today we have Vaidya Charithra Hebbar ma'am. She is a professor and head department of the Agada Tantra in SDM College of Ayurveda and Hospital in Udupi. She has a clinical experience of 18 years, PG and PhD in Raveguna, authored several journal articles, magazine articles to enrich both student, community, and public, resource person and organization of several international, national, state level conference. I welcome you, ma'am. Ma'am will continue the session.
Yeah. Thanks to Panchajanya for this beautiful occasion. It's a privilege for me to educate the student community, especially those who are now appearing in the exams. And very warm wishes from SDM College of Ayurveda Udupi. So today we will be talking on the topic called the death. So the main topic being thanatology. That is nothing but the study of the death. So as you know, this year onwards, it is the NCISM syllabus, the newly framed one. And here certain learning objectives are given. And especially for each topic, there is a narration, like how the topic has to be studied and how well the student has to prepare himself for the examination purpose as well as the professional purpose. So, when it comes to the death overall, the topic or thanatology overall, the topic, it is in the category of must know because the death is inevitable. And as Vaidyas, because we are dealing with the live patients, we also need to know if not live, they go to the next step called as death. So it is very important that the student should also be aware of what happens during the death. And this is also going to help him or her to abide by the rules and regulations, even in his clinic with medical ethics. Apart from that, it also may sometimes make him uh, help the law as to analyze a crime. So the death has a varied type of understanding, and here NCSM syllabus has introduced as a must know topic, and student needs to know how it happens or appears in a live body. And when it comes to the examination preparation, it is told that both in the theory and viva, he may be analyzed. The examiner can analyze him. And when it comes to the theory part, he is supposed to write a essay type of a question, essay type of answering. And when it comes to the viva, he may be asked some formative and summative type of queries. It can be a multiple choice or it can be anything as such, narrative type also, because in practicals also you have got certain area wherein you may have to write, or else it can be oral questions wherein certain part of the total topic can be analyzed by the examiner to know how rich you are with the knowledge about the death. So, as you all know, the thanatology is the study of death from all angles. In general, this particular topic is considered as study of death. But when it comes to the forensic thanatology, prefixing it with the word forensic, it means the study of death from the medico-legal angle. That is where our subject is interested. So, a student, our subject, is interested in the forensic thanatology, that is the study of death from the medico-legal angle. Now, let us go into the concrete of definition of death. Of course, in Viva, they may not be asking you, or in examination, essay examination, they may not be asking you a elaborate type of question on definition of death. They may simply want you to explain in 3 or 4 lines the definition of death, but still you better know from the angle of oral examination, there are different theories. For example, Black law is one of the theory or dictionary. As per his dictionary, it is nothing but cessation of life or ceasing to exist. And in case of Australian law, wherein overall the country it is considering, it is nothing but irreversible cessation of circulation of blood in the body of person, or irreversible cessation of all functions of the brain of the person. So here both circulation of the blood as well as the function of the brain are given the emphasis. Similarly, if you go through different physicians of the world, overall, a general thinking of a physician is that there is stoppage of the circulation with the consequent cessation of the vital function. Overall, the animal has a stopped the vital function of different organs. So that is what the physician was understanding till long years. Now, concentrating on the medico-legal definition, what exactly you have to write in the exam: permanent, irreversible cessation of function of 3 interlinked vital systems of the body. Permanent, irreversible cessation of what? Of 3 vital systems. That is nervous system, circulatory system, and respiratory system. So the cessation is permanent and it is irreversible. So these 2 terms should be there in your answers. And going on to little more elaboration of this particular topic, you also may be asked about brain death and brain stem death. So let us understand. So because if brain is dead, there is no question of the transplantation of the anything, any organ, which may be really vital for somebody else to live. So in that way, whenever the person is having the concept of the brain death, then a living heart can be transplanted for a dead personality. So the old definition, like cessation of vital functions of different organs, many a times doesn't hold good here, because all the organs, if they are if they have stopped their function, then there is no question of transplantation of the organs. So very important is to identify the brain death and what are the criteria for the identification of the brain death. Because once the brain death occurs, still there may be the functioning of different other vital organs of the particular body. And if you identify, there are chances that the transplantation of the organ can be made essential or can be made possible. So both eyes are open here or dilated, or it can be unresponsive pupils. No voluntary and involuntary responses or reflexes are there. So without the machine, he cannot breathe. There is no heart or brain waves as such. And another concept is brain stem death. Here, this particular criteria is also called as Minnesota criteria. And here, brainstem is very important part as identified by different physiologists. So, what is the reason to identify why we have to consider the priority of the brainstem means? Because it is having the resistance to the anoxymedullary neurons, which are resistant to the anoxia, and also it is responsible for all vital functions of the body, and it is the pathway also to all other vital organs. So, brainstem, if at all it is dead, then no question of further using the particular organ for the transplantation. So, in that way, very, very important understanding here of the brain stem death from the point as Minnesota criteria. Following points we have to analyze. One is no spontaneous movement, no spontaneous respiration if tested for a period of 4 minutes, absence of 5 major brainstem reflexes. For example, it can be the pupillary light reflex, no blinking, absent corneal reflex, no grimacing, and absent ciliospinal reflex, absent vestibulo-ocular reflex, absent gag reflex, and you can also do a EEG and you can find out if the brain stem death has occurred. So all above findings must remain unchanged for at least 12 hours. So this is the concept of brain stem death. Now, how you analyze the moment of death? So exact moment when the person dies is considered as moment of death. So how do you analyze it? Certain things are there. For example, the person is not receptive, he is not responsive, and there is no movement or breathing, there is no reflexes, and you can see there is a flat EEG. And again, if you are going to test also for 24 hours, there will be no changes. So, what is this? This is nothing but brainstem. What I had explained to you about the brainstem, it is nothing but the same thing. So for us, the brain death is very important for the transplantation of the organ. Now, why we have to study from the point of forensic view? What is the medico-legal importance of knowing about the death? Means number one is about the section 46 IPC, which states the fact that the word death denotes the death of a human being unless the contrary appears from this context. So when you tell death, so the first priority is for the human or the person who is living, or until unless it is specified like any animal or anything as such. So IPC 46 section tells about the same. So now it is Bharatiya Nyaya Samhita. So now for us, let us concentrate now only on the section 46 IPC. Next, disposal of the body. For that also, you have to declare the death, isn't it? Very important. Simply, you cannot dispose the body without confirming the dead, whether the person is dead or not. So, for example, you can have different types of the disposal. You may bury the body, or you may go for a cremation of a dead body. So ultimately, you have to observe for any movements, etc., even during the disposal of the organ. So many a times what happens, certain movements may occur in the hand and feet of that particular cadaver, creating an impression that the person is not actually dead and the disposal is premature. So very important is the confirmation of the death before the disposal of the organ. And as I told you, the tissue and organ transplantation, very, very important. That is the somatic death. So the first area is the somatic death and not the molecular death. So the first stage, that is the somatic death. After the somatic death, the viability will fall. The viability of the transplantable tissues and organs will fall sharply of the somatic death, because you know the word somatic refers to the organ, right? So when you're telling the organs are dying, automatically you should understand the organs cannot be transplanted also. There may be some less viability there. So there are certain criteria or time of transplantation for each organ depending on the viability. For example, a liver must be removed within the 15 minutes, kidney should be within 45 minutes, and heart within an hour. So in that way, it's very important that particular methodology is followed properly. That is why the understanding of the death is also very, very important. Another area is the legal presumption of the death. Like, how do you understand whether the person has really, he is dead, or maybe somewhere else he is living, isn't it? Because many times the people go absconding. So there is presumption that the person might be living some elsewhere, or if he is heard of. Usually, the waiting period that the person is not heard of is 7 years. In India, it is 7 years. So, by even though there is a presumption that the person may be dead if he is not heard of in the matter of 7 years, still it can be proved otherwise. So, it can be proved otherwise, but with the evidence. And who should produce the evidence? The person who is claiming that the particular person is living. So whatever is to be done as rules and regulations to produce the evidence, etc., it is the burden of the person who affirms it. So in that issue also, it is very, very important that the legal presumption of the death in India should be understood. So, for example, just to quote about it, Section 107 IEA, or Indian Evidence Act 1872, deals with the burden of proving the death of a person known to have been alive within 30 years. Accordingly, when the question is whether a man is alive or dead, then it is shown that he is alive within the 30 years. The burden of proving that he is dead is on the person who affirms it. So, otherwise, also, like if a person is living but somebody is telling he is dead, then also to prove that he is dead is taken as a burden to that particular person who affirms it, and he should collect all the evidence required for that. So in that way, the law has left all this collection of the evidence about the death of the person to the person who is affirming it. Apart from that, when it comes to the context of the clinician, whenever the person is dead, who is to declare, especially when it comes to in a general clinic, a setup of a clinic or a hospital or something like that, usually the doctor who is treating the patient, or maybe if a patient party comes over and he is asking for the doctor to come to his house, visit his house, and just declare the death of a particular person who may be related to him, or else the person is brought to the hospital and later the hospital people, they are requested to confirm the death. So there are different scenario which happens when it comes to the death. But who will declare the brainstem death is very, very important. So number one is Indian law, which is adhering about the certification by the board of medical experts, especially the RMPs, who is in the charge of the hospital in which the brainstem death has occurred. An independent specialist nominated by the doctor specified in the clause 1 of the Transplantation of the Human Organ and Tissue Act 1994, and neurologist or neurosurgeon nominated by the RMP specified in the clause 1, and also RMP treating that particular patient. So in general, because it is a issue of transplantation of the every issue is important. Disposal of the body is also very important. At the same time, if they want to go for the transplantation of the tissues and the organ, that is also very important. So in both the areas, the declaration is that the patient is dead is again very, very important concept. Now, what happens during the death? So one, as you all know, the loss of life functions, and person may have his last breath. So the moment he dies, he may be having, you might have seen somebody dying also. A last breath is there associated, and there may be something called as death rattle, like noise, and some liquid sound may be there, bubbling sound may be there. And usually, when it comes to the clinical death, you are assessing the pulse, you are trying to analyze if he is respiring, you are trying to analyze whether he is also having some cardiac beat, etc. etc. So, in such cases, there is no pulse, no breath. And when it comes to the brain death, there is no central nervous system activity. And the life activities may continue only with the aid of the machines. So, that is what happens during the process of the death. And the determination of time of the death is also very important when the person has died, because there may be the claim of the property, etc. Or as important is the birth time, so is the death time also. So because in India many rituals are also done, right? So in that way, the time of death is also very important. Maybe horoscopic views, etc., etc., can also be add on. So in that way, one is the eyewitnesses and another is as the tests. So forensic expert, how he will estimate the time of the death based on different changes which occurs after the death in that particular body. So speed of the death is also very important, like how the death is, whether it is instant. For example, a big explosion occurs and the person dies instantly, or it can be rapid, fairly rapid. For example, gunshot, or it can be a result of the shock. For example, heart attack. So, where the blood doesn't go into the cells at all. That is why it is just shutting down of the body. So, all the cells are shutting down. Sudden shock. It is nothing but sudden shock. Or it can be a progressive dying. For example, aging. Okay. So, usually the people prefer the progressive dying, isn't it? Nobody would like to have a sudden, instantaneous, rapid like death as such, but it is nothing but the progressive dying. So, in progressive dying, illness with the death in the days, months, years. For example, there is a illness, or there may be because of the aging process. So there are certain tests also, and these tests are very specific to the brain, heart, and the lung activities. So if some stoppage has occurred to these vital organs, brain, heart, and lung, it means atrium mortis, means death of the total organs. So the gateway of death it is called. So certain test will be there. For example, how to tell about the circulation, whether it is intact or not. For example, you have to auscultate the cardia. So with the help of the stethoscope, you can do that, or you can take the ligature test. So, for example, you are tying it to one finger with the pressure, and you are seeing if the circulation is maintained. As such, there is a swelling or something like that. If no swelling or something like that, then it means there is no circulation which is maintained. Similarly, diaphanous test is there, and fingernail test, cutting of the small arteries, heat test, etc. So, among these tests, some of the tests you can write down also. If definition of death and confirmation of the death. If there is one sentence called as confirmation of the death, you can write down these particular tests. Maybe at least you can mention it. If not, you explain it. Similarly, test for respiration is there. For example, Winslow test. Like you're placing some liquid or something like that below the xephisternum, and if there is any changes on of this particular chest, the liquid also will be having some movement. So it means the person is living. Otherwise, the person is not living. Mirror test, wherein the mirror is placed in front of the nostril and the mouth, and if it becomes hazy, it means some vapor is passing off in the breath and the person is living. Similarly, the feather test, because the feather is very, very finest. So, if it is placed in front of the mouth and the nostril, the movement what occurs suggests that the person is live. Similarly, there will be test for the brain function also, like you can blow a strong stimulant into the nose, or you can you can put an instrument under the nail, or it can be some hot water or oil which you are going to spill on the body. Like, there will be reflexes, right? All these reflexes are lost if at all the person is dead. So you try to protect yourself. Usually when some strong stimulus is given, you try to protect, or you try to react to those stimuli. And usually in life all this happens, but in death all these stimuli has no response. For example, trumpeting, or giving a loud sound, or maybe some pressure on the eyes are also given. So in that way, different methodology is there to test the brain function. Now, even when it comes to the objective, learning objectives about the stages of the death also, it tells you should know the topic properly, must know category, and the stages. So this is a very usual question, it may be asked. So stages of the death means usually you have two stages. One is a somatic death and another is molecular death. So two stages will be there. So somatic death is nothing but clinical death. It is also called as clinical death, legal death, systemic death. Here what happens? The organ is dying. So that identification of organ dying is very, very important. So that there are, this is the area wherein go for the transplantation. So it is nothing but the uh, uh, when the irreversible cessation of the heart, lung, and the brain. So nothing but Bychart's criteria. Okay, this is also called as Bychart's criteria, where there is irreversible cessation of heart, lung, and the brain. So usually is brain death. Later it will finally go into the brain stem death. So ultimately, brain stem death is nothing but the somatic death. So first dies the brain, later dies the stem as a whole, which is corresponding with the somatic type of the death. So several cells of the body may keep functioning even after the somatic death, because it is overall the organ which is dying and must not have affected the tissues or further minor whatever the cells etc which may be there in that particular tissue. So somatic death is overall cessation of the function of a particular organ. Specifically, the three organs are mentioned, the vital organs, the heart, lung, and the brain. Identifying the somatic death is very important, because again you have two things here happening. One is brain death and another is brain stem death. And brain stem death is something which is corresponding with the somatic death. Prior to that only, if you are able to understand, then the transplantation of the organ is easier. And apart from that, there is molecular death. So here, death of all individual cells within the body. So the first step is organ as a whole or the body as a whole. Later comes the minute organs or minute cells. So individual cells are also so much affected that whatever minute to minutest biochemical activity is happening in that particular cells, that stops. So it may take after 2 to 3 hours after the somatic death. So initial occurs the somatic death, later comes the molecular death. So 2 to 3 hours it may take for the molecular death. So identifying this step is very, very important again from every angle. Every angle from the point means sometimes treatment also you have to plan accordingly, right? Or transplantation of the organs, or it can be the declaration of the death as to disposal of the dead body, or it can be the estimation of time of the death, which may bear some civil and criminal privileges. Civil or criminal court may need the evidence. And what is the evidence? The doctor certifying the death. That also becomes the evidence. So that is why you have something called as death certificate. So who gives the death certificate? The doctor only will be giving you, the physician himself or the hospital authorizing this particular death will be giving the death certificate. And this death certificate is nothing but the evidence. So it is nothing but the documentary evidence. You have got two evidences, right? So the documentary evidence also include this particular death certificate. So there is many purview. That's what I was telling you when I initially started the particular topic. Here, next step is you have to understand what are the modes of the death. So modes of the death also for you is a must know question, and you may be asked about the modes of the death in your major question, like define death, give the confirmation test for the death, and explain the stages of the death, wherein you have to explain the somatic and molecular death. Later, the next question may be explain about the next sub question, maybe the explanation for the modes of the death. Now, what are the modes of the death? Many a times you have confusion with the stages of the death and modes of the death. When we are asking about the stages of the death, student will tell coma, asphyxia, syncope. No, this coma, asphyxia, and syncope is nothing but the modes of the death. Stages of the death means initially the whole body or a organ specific, later the molecular level death what occurs. So these are the stages of the death. But when it comes to the modes of the death, coma, asphyxia, and syncope, you have to tell like that. Okay. Coma means, again, we already have told about the cessation of the different organs, right? Coma is specific to the brain. Asphyxia is specific to the the heart, and the syncope specific again towards the lungs, respiration. So in that way, the coma, it results from the sudden stoppage of the functioning of the brain, very specific to the brain. So here the vital functioning is in the brain. So here what happens? There is sudden stoppage. Sudden in the sense, depending on the cause of the death, again different causes will be there, right? So depending on that, there will be stoppage of the functioning of the brain. And person is not at all erosible. You cannot make him arise. You're calling him by the name, or you may be giving some stimulations, etc., but still he is unerosible. He is unconscious, and there is no response to the external stimuli, or he himself is not telling anything externally. When you're giving any stimuli, hard stimuli also, he is not responding. So in that way, usual thing what happens is unerosible, unconscious type of the stage is actually appearing in front. So you may think of different modes of the death, one being the coma. So here what happens? It is nothing but in coma what happens? Though the impact is on the brain, the impact is also on the lung and the heart. So syncope also will be there. Asphyxia also will be there. It is combination, but nothing but the syncope and the asphyxia. So what happens here is there is paralysis or insensitivity of the central portion or vital centers of the brainstem. So again, see, the concept of the brainstem has come over here. In coma, what happens? The brain stem is affected. Now, what are the causes? Why anybody will go for this particular coma means, usually it will be a direct impact on the brain itself. Maybe some diseases of the brain is there, some injury of the brain is there, or maybe its membranes are injured. There may be some hemorrhage, like intracranial hemorrhage, some inflammatory damage may be there, or maybe abscess is there, some growth, neoplasm, etc. is there. So that is one area where there is a direct impact on the brain, or else indirect impact. For example, there may be some poisoning what has occurred. Okay, there may be a heavy dosage or dosage of certain medicines, or it can be different other poisons what we have already gone through, isn't it? Last different total classes has also told you about the stavara visha, etc., right? Or it can be some mineral also. So in such conditions, opium, to give an example, it can be opium or cocaine, or it can be some barbiturate, or it can be even the alcohol. So alcohol, it directly affects the brain, right? So in that way, there are different other medicines, different other food, different other substance abuse, this thing which lead to the abuse, the substance which lead to the abuse, wrong usage, or maybe overdosage, etc., which is going to give the effect on the nervous system. Another impact is again indirect. For example, metabolic disorders. There is some affection or maybe infections in some other area. Maybe there is uremia or diabetes or pneumonia or some infectious diseases, infectious fevers, heat stroke. So heat stroke is again very common where there is impact on the brain. So in that way, you might have heard when it comes to the heat strokes, so many newspapers give you the cause of the death, isn't it? So elsewhere, especially in the North India, in North India, everything is extreme. Even rain is in the extreme, and even the sun goes to the very extreme level. So, wherein many deaths may occur, and heat stroke also can be a cause of death and leading to the impact on the brain, leading to the coma. So, other causes can be embolism and thrombosis in the cerebral vessels, epilepsy, hysteria, etc. So, these are the general causes. There may be other causes also. And apart from that, you also have to concentrate or write down a note on the autopsy finding. Like you have the postmortem findings, like brain and meninges can be congested because direct implication on the brain itself. So they are congested, and right side of the heart is usually full, left is empty, lungs are congested. As I told you, it is a combination of asphyxia as well as the syncope. The coma is nothing but the combination of the impairment of the functioning in the heart as well as the respiratory system. So here what happens? Even the heart and the brain and also the lungs are affected. When it comes to the brain and meninges, it is congested. Right side of the heart is full, left side is empty, and lungs are congested. So in that way, you have to remember and write down. Next one is the syncope, where there is stoppage of functioning of the heart. So syncope is with reference to the heart. And here what happens? The mechanism is usually concrete on the vasovagal attacks. Vasovagal, so vagal attacks, vasovagal attacks resulting from the reflex parasympathetic stimulation, reflex bradycardia or asystole, or by the reflex splanchnic vasodilatation. So ultimately, there is some circulatory changes. Here, what happens? The heart is something which is helping in the circulation, right? So it goes on. The impure blood, pure blood, whatever the concepts are there with the direction of the physiology, you just remember it. There is some changes here. Why it changes means some pressure goes in imbalance. So whatever pressure has to be maintained, that is not maintained. So usually the blood pressure will fall, and because of that, there may be some anemic type of attacks, and especially this anemia will affect the brain, and there will be unconsciousness. So in that way, the syncope happens. Usually, when this is a very common thing, what occurs even in when it comes to the dissection hall, isn't it? So usually when the first time the student is seeing the dead body, and whenever you are doing the dissection of the dead body, the first thing what happens to many of the students is they go for the syncope. So the recovery is 100% there, but still many a times this may continue to the extent of stoppage of the functioning of the heart, and later lead to, see, only brain, to the extent of the brain some impairment happens, some unconsciousness happens, he will regain the consciousness. But if that damage is such that the anemia or ischemia, anemia will lead to the ischemia, ischemia will lead to the damage of the vital centers of the brain and also the heart, all those things, if that is again going on further, then there are chances that it will lead to the death as well. So in that way, syncope also can be something called as mode of death. Now, how syncope happens? Syncope happens because of usually anemia. So, why? And in India, many people are anemic, isn't it? So, the anemia can be a very horrible cause for the death. And usually, the anemia may be because of various diseases. or else it can be because of sudden hemorrhages, what can happen, or excessive hemorrhages, maybe traffic accidents, etc., etc. Or maybe some heart disease is there and the heart muscle is so weak, or it can be because of fatty degeneration of the heart, etc. Or maybe there is some myocardial infarction, exhausting disorders, or there is some cardiac poisons, okay, some entry of the cardiac poisons into the body, or maybe some cardiac inhibition is there. Suddenly you got a fright, you saw, you many times this also happens, isn't it? If you are afraid, sudden fright or sudden emotion, something like that, then again it will be a problematic to the heart. So usually the wrong ideas what occurs during the relatives, so that many a times leads into the during the maybe some passing on of the emotions, many a times it may result into the death as well, okay. So somebody dies in the family, the shock which happens because of the news itself may carry on towards the appearance of another death of the family member. So in that way things happen because of the impact on the heart. Now, what is the clinical feature? Pallor of the lips, face, dimness of the vision, dilated pupils, skin cold with the perspiration, gasping respiration, nausea, vomiting, weak, slow pulse, fall of BP, delirium, convulsion, and death. Because the total consideration here is the whatever the impact is there, it is on the heart. And autopsy finding is also important. Very specifically, you have to mention about the heart being contracted, and because heart the heart is trying to do something, it is trying to pull, totally pull and push and do some pumping. So that is why it is in the contracted type of appearance, and chambers are empty and very little blood is there, because already there may be some hemorrhage, anemia, as already we have discussed about it. And almost all the viscera, lungs, brain, abdominal organ, etc., will be also affected with the less blood. So this is what is found in the autopsy finding. Next one is about the asphyxia. Asphyxia is very specific to the lungs. As you know, asphyxial death, right? We have the strangulation, hanging, etc., also discussed in the forensic areas, right? In your own chapters. So, in that way, the type of the asphyxial death, including drowning, okay? So, gagging, choking. So, all there are different terms which are different causes attached to the asphyxia only. So here what happens? There is an interference of the respiration. So somebody is respiring, suddenly there is interference. How it is interfere? The interference can be anywhere, starting the nostril, or it can be in the neck, or it can be in the further areas. So in that way, what happens? Sudden stoppage of the function of the lungs occurs, and this again leads into the unconsciousness. So unconsciousness may be there in the three modes also. Even in the coma also unconsciousness is there. Heart problem or syncope also, the unconsciousness is there. Asphyxia also, unconsciousness there. But the organ which is affected is different. Now, mechanism is, first of all, the failure of function of the heart. Because of that, impaired blood oxygenation will be there, leading to the tissue anoxia. Again, here also the anoxia is affected, and especially because lung is the main vital organ which is supplying the oxygenated blood to every area, right? So here what happens? If the lung has stopped its function, then automatically the oxygen is not supplied, and if oxygen is not supplied, there is anoxia. Anoxia will lead to the damage of different tissues. For example, nervous tissue is affected. Okay, and there may be some other form of asphyxia also. Usually, because once nerves are affected, there is again irreversible thing, isn't it? So, if the nerves are not getting the oxygen properly, you know that nerve cells once damaged, many a times may not regenerate, may not be in a position to regenerate. So that is why there will be rapid unconsciousness. So, and in all types of the asphyxia, what happens? The lung is affected, heart is affected, but sorry, lung is affected and brain is affected, but heart will continue to beat for several months after the stoppage of the respiration. So, already I had told you that in coma, what happens? It is a mixture of asphyxia and the syncope. When it comes to the syncope, what happens? There is indirectly it also affects the lungs, it also affects the heart. But when it comes to the asphyxia, what happens? In asphyxia, brain is affected, but heart may not be immediately affected. It will somehow survive for certain time, several minutes it may go, and breathing stops within 20 minutes of the cardiac arrest. So the and later the heart stops within 20 minutes after the stoppage of the breathing. So once the breathing has stopped, later stops the heart. So, but when it comes to the nervous tissue, the brain, isn't it? Because oxygen deprivation means the brain is the first one to get affected. So all the nerves are totally damaged here. So it leads to the anoxia, later to the death. So brain is the one which is highly affected here. Now, what is the clinical features? So here what happens? Three stages will be there. In asphyxia, three stages. One is dyspnea. The person will, replacement of the oxygen. What happens? Excess accumulation of the carbon dioxide will be there. And whenever the carbon dioxide comes inside, automatically respiratory center is stimulated. And when it is stimulated, high rate is there, isn't it? The respiratory rate becomes heavy and the respiratory movements become heavy. That is nothing but the stage of dyspnea. Next comes the stage of convulsions. So once the dyspnea occurs, and dyspnea occurs, the dyspnea should rectify, isn't it? Actually, in asthma and all, what you see, dyspnea is there, but somehow you are making the particular thing replaced with the oxygen, right? Somehow that CO2 which is accumulated in the body, you are trying to replace it again with some oxygen, maybe the capacity of lungs, or maybe some medicines, okay, which is going to accumulate the oxygen, or maybe inactivate the CO2. So in that way, some understanding is there in the case of pharmacology. So that things will be helping for a asthmatic person. But here what happens? Here, because it is the deathbed, right? So next stage is the stage of convulsions. So here again the dyspnea will increase in such a way that there will be some masking. Okay, the particular person becomes unconscious, and later he will go to the convulsions, and all congestion will be there. The person looks cyanosed, and this stage will be around 1 to 2 minutes. Next comes the stage of exhaustion and the respiratory failure. So here it lasts for 2 to 3 minutes. So totally the thing happens in 3 minutes. So the first moment is stage of dyspnea. 1 to 2 minutes later occurs the stage of convulsions. The ultimate 2 to 3 minutes, third minute, what occurs is nothing but the respiratory failures. So once the respiratory failure is there, what happens? All centers, okay, brain centers are also totally paralyzed, because no oxygen is there. No oxygen is there means they are paralyzed. The muscles are flaccid, reflexes are lost. And in between, long gaps, the breathing occurs, and later it stops. The pulse also is not found. The heart will continue to beat for few months, few minutes, and then it stops, declared as a death. So in that way, the things happen in the coma, syncope, and asphyxia. In case of asphyxia, what are the autopsy finding? As I already told, cyanosis is very important, because we are talking about the concept of oxygen and carbon dioxide. So automatically, when there is no oxygen, you have cyanosis. So usually this cyanosis is nothing but, again, going into the deeper postmortem hypostasis. So what is postmortem hypostasis? We'll discuss again later. coming just in few slides away. We'll be discussing it. So the color changes will be there. So whatever color changes occurs in the death as a routine, that is more deeper when it comes to the particular asphyxial type of the death. And you also have petechial hemorrhages, visceral congestion, cardiac dilatation, etc. And also, depends on the cause of the death, like whether it is by hanging or strangulation, etc. Like if at all it is by the hanging or strangulation, you may see a ligature mark. There may be a fine froth in the nostrils, depending on the cause of death again, wherein the person is drowned. That is why the asphyxia has occurred. So the froth is a very important matter to identify the person has death is dead by the drowning, isn't it? Froth is a very important point. So all these things, what happens after the death, will give you a clue how the death has occurred. And also the constriction of the neck, as such, about 50% of the cases with the constriction of the neck will not show the signs of the asphyxia. So actually, the death may occur by the cardiac arrest also. Okay. So asphyxia means it's not very typical that the people have gone for some constriction of the neck, etc., etc. Okay. And also natural diseases also you can find the asphyxial sign. So one has to be very much alert to really identify the asphyxia as a mode of death when it comes to the identification in the dead body, the modes. Next, now let us understand. Now we have come to know the definition of the death, how to confirm the death by different tests, and we also know why legally it is very important to identify and understand death. Now let us understand the changes also after understanding the steps and the modes. Steps of the stages of the death means somatic death and molecular death. Modes of the death means you have coma, syncope, and asphyxia, which has to be explained. Now, what are the changes after the death and why we have to study it? Okay. Now, again, the time of the death is very, very important to understand or make clear the responsibility of the law. Okay. To help the responsibility which is there as a medico, to help as a help a law, help the law. Okay. So, for example, if you have to ascertain the time of the death, then it's very important that you understand the different stages. Okay. For example, what is aglor mortis? What is livor mortis? What is rigor mortis? What is forensic entomology? What is vitreous? What is the role of the vitreous humor and its chemical analysis? And whenever the body is found in the stage of the decomposition, then how to ascertain about the time and the cause of the death, mode of the death, etc., etc. So likewise, all these are very, very important. And other thing is, as a general understanding, one is time of the death, or what we call as postmortem interval, PMI. The short form is PMI. And another is probable position of the deceased at the time of the death. So what position he was, whether he was floating or whether he was he's keeping his face underneath, okay, or whether he was standing or whether he's still sitting, everything. Cause of the death is also very important, like what is the cause of the death, like whether it is hanging or strangulation. Cause of the death, in the sense, you can also consider it as accident, suicide, or whether it is the accidental, suicidal, or homicidal type of the cause of the death. Another is the manner of the death. So, cause of the death from the point of different types of asphyxia, or different types of the reason of syncope, different types of reason of coma. As I told you, for example, a disease, maybe aging, etc. Manner of the death, in the sense, again, you can consider. In cause of death also, these points will come, and you have to elaborate. Okay, you have to elaborate. Cause of death being suicidal, what is the reason, what is the thing he used for the suicide? For example, he might have used some organophosphorus poison. So cause of the death is organophosphorus poisoning. But the manner what he selected is suicidal. So suicide, homicide, or accident. So again, you have to understand the stages of death, modes of the death, cause of the death, manner of the death. So these terms has to be defined very well by you. Now let us discuss how to write in the exam about the changes after the death, which has to be explained in 3 paragraphs. Okay, immediate changes, early changes, and late changes. First is immediate changes. Next comes the early changes, and next comes the late changes. Many times, what happens? Students they are confused between immediate and early changes. For immediate, they write early changes. When asked early changes, they write about immediate changes. So you should be very definite. You have to understand it is IEL. Okay. Again, must know category only. All these changes and its answers. So in immediate changes, what happens? Immediately, the word itself will tell you immediately after the death, what happens? A clinical death or somatic death. It's also called as the somatic death, what we have already explained as a stage of the death, wherein we are telling that the whole body is presumed to be dead. The organs specifically, the vital organs are dead. So here this is nothing but the clinical death. Okay, in clinic, a doctor how he tells, he observes the pulse, he observes the heart, he observes the nervous activity. So all these activities are ceased. So that is why he says the person is dead. So immediately, what are the signs to tell the doctor that the person is not living? Means insensibility, respiratory arrest, circulatory arrest. What we had discussed from the point of coma or syncope, or it can be the asphyxia, isn't it? So all these area show some signs, isn't it? It can be any mode. Ultimately, everything is overlapping. All the modes are overlapping. When it comes to the death, it is a very complex thing. What happens in the body? So in immediate changes, what happens? The appearance is insensible appearance. There is respiratory arrest and also the circulatory arrest. So what is insensibility means? It is nothing but no response to any stimuli, whatever is given. It can be a painful stimuli, it can be some tactile painful stimuli, or it can be some sound, okay, you are calling by names, okay, or it can be some temperature, some hot things you are pouring on the body. So for anything, the particular person is not at all giving the response. And also the voluntary movement is not at all there. Any voluntary movement is not at all there. So here, very important thing is they are the earliest sign of the death. But one thing we should understand is they are also found not only in the death, they are also found in some other disease conditions. For example, say the person has fainted, okay, or the person is in the epilepsy, or there is some vagal inhibitory phenomena, or maybe he is in the electrocution, or maybe narcosis or catalepsy. So some other problems trans, okay, in such conditions also what happens, he is insensible, right? So a particular person being insensible is not at all a reason to declare the death. So how to confirm that he is insensible means you have to go for the EEG or EEG rhythm, okay. So what we have to understand here, either it is a flat or loss of the EEG rhythm. Next comes the respiratory arrest. This is nothing but what we had discussed in case of the asphyxia. So very concrete towards the functioning of the lungs. So total stoppage of the respiration. So respiration has totally stopped here, and you have observed it for more than 3 minutes, and you see the respiratory whatever the things has to happen in the body is not happening. So here one thing we have to understand here is you can hold a breath, isn't it? Even in the pranayama, you hold the breath, isn't it? So a very long respiration may be there, and wherein there may be the holding of the breath also may be there. So it depends again on what the particular person is doing there. So it can be holding the breath, or it can be some asthmatic conditions or chain strokes breathing system, okay. especially the person, maybe the pattern has changed. The breathing pattern has changed in, especially in a patient who must have drowned and he is surviving, or maybe newborn infants, etc. Here also the breathing pattern is totally different. So in such cases, just telling that the respiration has is not perceived by a doctor, you cannot tell that it is death. So what you have to do, you have to do some test to affirm the cessation of the breathing. As already we have mentioned the different tests, isn't it? So for respiration, one test, brain, one test, and circulation, one test. So in respiration, feather test, mirror test, and Winslow's test, etc., whatever we had discussed earlier, it can be done. Now, the second thing, another thing, what happens is the circulatory assess. The third thing, whatever is happening, insensibility, respiratory arrest, and now cardiac or circulatory effect arrest. So here what happens, it is a complete absence of the heart sound at least for 3 to 5 minutes. So you are listening to the heart sound, but it is not at all heard. How you are going to do it, you are auscultating the heart sound by the stethoscope. You are doing it for around minimum of 5 minutes. There is no audible heart sounds at all. Then you can also go for the EEG recording or ECG recording. So it is totally flat. And another other test what may help you is Magnus test, diaphanous test, ICAR test, and also fingernail test. All these tests also can be contributory or supportive to whatever the declaration you can do in the hospital or the clinic, or maybe in the patient's uh, residence. Another thing, when it comes to the death, there is something called as suspended animation. It is nothing but apparent death. For example, apparent, he looks dead. Okay, he looks dead. Here, what happens? Vital functions of the body are maintained in the very low pitch. The Chaitanya, we call it in the Sanskrit, isn't it? So, how you tell a person is living? It is nothing but the Chaitana. The total Chaitana is so active, enthusiastic. But when it comes to the apparent death, the Chaitanya, the level, the peak, or the waves is totally in the very low pitch. So this can be done voluntarily also by the patient or the person himself, or involuntary also. For example, yoga, pranayama, etc. It is nothing but regulating the breath sounds, breath overall, the circulation. So here the particular person can maintain a very low pitch chaitanya. Similarly, involuntary in case of the newborn, and as we already discussed, drowned people, cholera, and frozen coma, and anesthesia. After anesthesia also, shock, sunstroke, etc. So this suspended animation identification is also very important, because you are declaring the death here. So if the person is looking like a death, it doesn't mean he is dead. There may be different other reasons why he looks like a dead person. So it is very important that before you declare the death, you have to make sure that the person is not in the suspended animation state. Then only you have to declare the death, and then you have to issue the death certificate. Now, when it comes to the early changes, so early changes is nothing but the changes which occurs in the body in the first 12 to 24 hours of the death. So now immediate changes we have discussed. So immediate changes means insensibility and cardiac arrest, respiratory arrest. So in this condition, you also have to analyze the person is not apparently death, means suspended animation is not there. So that also you have to understand. Then only you have to go for the observation of next changes. That is which occurs in the first 12 hours or maybe 24 hours. Sometimes depending on the climate, depending on the age, sex, etc., etc. 24 hours also you may have to observe this particular early changes what occurs. So what they include means, one is the postmortem cooling. It's also called as agglor mortis. Pallor, a general pallor, specifically the facial pallor. The changes what occurs in the skin, that is the loss of elasticity. Changes in the eyes, muscle changes, what occurs in the blood, muscle, because skin we have discussed. Similarly, muscles also. Next, postmortem lividity and also the rigor mortis. So these are certain things what occur as a early changes in the after the death. So now let us go one by one. What and all we have to cover in our answers, sir, is also very important. If not everything, at least minimum of 3-4 points at least you have to cover so that you get good marks. So aglor mortis means what? You have some synonym called as postmortem cooling. Aglor mortis means algor means coldness or chill. Mortis means death. So algor mortis, it's also called as postmortem cooling. Nothing but cooling of the dead body. Here, what happens in the algor mortis? The normal human body temperature, whatever is there, that will start reducing. Okay. Initially, the person was in the life. Later, he's dead. And once he occurs the stage of the death, the temperature what was there in his body that starts regressing. Why it regresses means the dead body behaves like an inert object. It is no more active. So what happens? The already whatever heat is there accumulated in the body, that starts to go away from the body, and that is nothing but losing the heat. And how the losing the heat occurs? It occurs by conduction, convection, and radiation. And until it reaches the equilibrium with the temperature of its circulation, surroundings. So the dead body will lose its heat in such a way that it will become like any other object, inert object, which is there in the vicinity. So, for example, there may be a table, there may be a bed or something like that. So, similar to that surrounding object, the body also will become very cold. So, 2 to 3 hours after the somatic death, the particular system may go on, but still, if at all the person has some infection, okay, maybe the bacterial action, because of infection, there is some bacteria which is active in the body. So that active bacteria is also still live, isn't it? So that living bacteria that may continue to produce the heat, and that heat is exhibited in the dead body. That can happen, but body itself is not generating any heat. So in that way, the body for some time it may show that it is having some heat. It may look as if the body is still hot. That is because of some infectious reasons. Otherwise, as a normal type of methodology, the body is going to lose the heat like anything, so as to mimic with the surrounding materials or temperature of its surrounding. So you can see this particular graph. The red line, whatever is there, that is a curve, like a S, isn't it? So that curve is depicting about the algor mortis. So how the temperature is coming down like a S. And that blue line, whatever is there, it is nothing but livor mortis, that we will discuss in the later. And the straight line, whatever is there, without any dots or lines or something like that, a continuous line. So the inverted type of a graph that shows about the activity called as rigor mortis, what occurs in the body. So following the primary flaccidity and followed by secondary flaccidity. It is nothing but the stiffness, what occurs in the body. So that is signifying that particular line. And later there is something, a purplish type of line, which is somewhat dotted as well as lines are there. So that is decomposition. That line signifies the decomposition. And different time is also there in the graph. When the algor mortis is starting, and when rigor mortis is starting, when livor mortis is starting, and when decomposition is starting. So that based on the time as well as the temperature, that particular chart is telling you some story of the death year. Now, how do you measure the cadaveric temperature is very, very important. That is based on the thermometer. So, the nothing but thanatology, isn't it? We are talking on thanatology. So, thanatology is about the death we are studying. Thermometer is nothing but a cadaveric or rectal thermometer. Okay, it is nothing but a thermometer which is going to give you the reading of the temperature and in the degree as well. So here what happens is you are measuring it either by the help of the rectal introduction, or else it can be by keeping it in the surface of the in contact with the internal surface of the liver, or by inserting into the vagina. So there are three ways. The very three common ways are there. Number one is using the rectum as a mode, or else you are using vagina as a mode, or else you are giving a small cut and you are seeing that underneath the liver. Okay, in as such, the contact should be maintained with the inferior surface of the liver. Like that, a incision is made, in the midline incision is made, and then the thermometer is introduced inside. Then the reading is very evident, and that thermometer should be put inside in 8 to 10 centimeters. So 8 to 10 centimeters deeper it has to be inserted. So that is nothing but the cadaveric temperature measurement. So as I already told you about the graph, okay, this is about the graph, how the thing happens. So there are three levels here. To become a S, the graph becoming as a S in the shape of inverted S. So how it is? The first hour, second hour, and three stages. Okay, first hour in the sense in first 2 to 3 hours. Next hour in the sense next 6 hours. Next hour in the sense 6 to 8, 12 hours. So matter of totally 12 hours. Okay. So by 12 hours, the body is going to become completely cool. And this 12 hours is divided as three stages. These 12 hours is divided as three stages. 1 to 3 hours, next 6 hours, and next 6 to 12 hours. So this is a general rule. Okay, but many times what happens, depending on the condition, as I told you, infection, based on infection and all, this time may change sometimes. So ultimately this will give you some analyzing, like immediately the temperature is there, later there is cooling, right? So for whether the time of the death has occurred in the first hours or second hours or third hour, that graph, depending on that graph, you can estimate the time. So PMI means again postmortem interval. So that is calculated using this particular formula, that is normal body temperature minus rectal temperature of the cadaver divided by rate of the temperature fall per hour. So how the temperature falls, what rate it falls is also very, very important. Now how we are going to you have to write about the factors also, like when you are writing about the algor mortis, you are writing about the factors also, what are giving some influence to that particular rate of cooling. For example, age, condition of the body, initial body temperature and position of the body, and manner of the death, and clothing, atmospheric temperature, size of the room, and medium of in which the body is placed is also very important. For example, one or two examples will take here. Age is, if at all the body is of young and the middle aged person, then it will cool more slower than the body of the children and the old aged people. So that is very evident. Even in our Ayurveda, it is told that it is Kapha Pradhana when it comes to the infants and Vata Pradhana when it comes to the old people. So automatically both are having the coolant effect or Shita Guna more predominantly. So in that way, they are more slower. They are more, what we can say, they are more uh, like uh, uh, they are going to absorb, or they would like to retain the heat, rather retaining of the heat is more here. So in that way, the bodies of the young and a middle aged person that are relatively bigger cool more, bigger in the sense, the people who maybe are little bit bigger built, depending on the build we can say, they cool more slower because the accumulation of the heat is more there. But here the accumulation of the heat is less. Miniature size infant is smaller in the size. Old age people also smaller in the size. Retainment of Shita Guna is more in case of the children and as well as the old, old people. So in that way, both are having the impacts like that. So the young and the middle-aged people will be relatively cooling out slower in the rate. Next is about the size of the room. We can take another example here. When it comes to the small, ill-ventilated room, then cooling is delayed. So because room is also very small, the passing of the particular ventilation, passing of the wind is very, very slow. So wind is very, very important. Conduction, convection, etc. So that is also one of the area what is considered here. Other factors, I think you can elaborate it in your exam. Similarly, there is something called as postmortem caloricity. Postmortem caloricity, the word itself is telling you that there is a rise of temperature of the body. Okay, rise of temperature of body instead of cooling of the body. So actually, what should happen? The body has to be cooling down. But here, what is happening? There is initial rise of temperature, and why it is happening? Again, because of the cause of death. How the cause has occurred. It may be because of sunstroke. Again, heat is there. Pontine hemorrhage, heat is there. Tetanus, heat is there. Strychnine poisoning, because there is constriction, contractions of the muscles. So heat is there released into the body. Similarly, bacterial infections, infections in the sense heat, however, is accumulated. Lobar pneumonia, typhoid fever, encephalitis, etc., etc. Example, in intense asphyxial conditions, rise of temperature is by 2 to 3 degree at the death. So in that way, you also have to, as per you are studying the algor mortis, similarly, you have to know about the term called as postmortem caloricity. Next, you have something called as changes in the depth. Changes in the eyes. So here, what happens to the eyes is also very important. Especially, there is blinking of the eyes in the life, isn't it? And the very active part is also in the pupils and different reflexes. What may be there adhered with the eye functioning. So all these are lost. So the cornea is dry and it is hazy. It is opaque and intraocular tension is falling down. So all these things you can write down, isn't it? Step by step, you write about the loss of the corneal reflex, the cornea turning opaque, etc., etc. Okay, and you can also write about the flaccidity of the eyeball. What happens in the pupils? Usually, it is dilated, and vitreous biochemical changes, because even in the chemical analysis, the vitreous humor is taken out. So, for example, some changes in the biochemistry will be there, which may be telling about the cause of the death as well. And very important is this particular word. Okay, in Viva also they can ask you tachynoir or tachynoir dela sclerotica. So this is very important. This is nothing but the brownish discoloration what occurs on the in the sclera. Okay, whenever the eye is exposed many a times to the atmosphere, when it is eye is exposed, if not closed, the eyelids are not at all closed during the death and left open for 2 to 3 hours, means what happens, because the eye is not working properly, right? After the death it is not working at all. So the whatever the debris is there, cellular debris, dust, etc., is there, so that and all will accumulate, and that will give a brownish color discoloration of the sclera. Okay, and to start it will be yellowish in the color. Later it will become reddish brown in the color. Lastly, it will become blackish in the color. So that is also giving you some time as estimation. So initially yellowish in the color, later reddish in the color, later black in the color. So it takes some time, isn't it? So that again is helpful for telling you the time. So you can see here tachonoid, that is blackish in the color, and about the opacity of the cornea which has occurred. Haziness is there, right? So that one. And changes in the skin is also important. The first and the foremost fact is the pallor. So the person looks very, very pale. And there is loss of translucency of the skin, loss of elasticity. Elasticity is such that if there is any wound, etc., that wound will look bigger, because it cannot close up, or the gapping of that particular thing will look will make the wound look bigger. Similarly, there will be some color changes like ashy white, pallor, etc. will be there, and especially more evident it looks in case of the fair-skinned individual. And of course, depending on the cause of the death, also the color will be there on the skin. For example, if he has died because of some liver infections, maybe he had jaundice during the time of the death, then it will be yellowish in the color or reddish in the color. Or maybe if there is carbon monoxide type of death poisoning, then it will be reddish in the color. Okay, cyanide also reddish in the color. So depending on that, the cause of the death also, the changes may be there. Next is changes in the lips and also the postmortem lividity. Postmortem lividity, you have to write another big para for that. So here there is a dead person wherein you can observe the lips, the face pallor, and even the eyes, etc. Postmortem lividity has some synonyms like postmortem stain, because when they may ask you postmortem lividity even in the short essay type or short answers. So here what happens, different terms may be asked: postmortem stains, postmortem hypostasis, postmortem suggelation, postmortem vibrices, and also liver mortis. So liver mortis was the term which we have used previously when we mentioned about the changes. So this is nothing but purplish or reddish purple areas of the discoloration or staining of the skin or the organ after the death due to the accumulation of the fluid blood. So blood will no more continue to be having a thick consistency. So rather it will become fluid. And all these fluid things, what is appearing in the blood, they go and settle in the dependent part of the body. And when they settle, automatically they are making the color appear on the skin. So that is nothing but the postmortem lividity. So here again, as once it is fluid and it goes into the dependent part, it cannot come back because it is that capillaries are toneless. The capillaries have no strength to make it come back, isn't it? Because there is no activity in the circulatory system. So that is why it is showing this discoloration. And almost all the skin, especially the dependent part skin, will be covering this color. Dependent tissues, dependent organs will be having this color. For example, the body is the supine position, then it will be seen in the back, ears, and also posterior aspect of the body, except the pressure point. So contact area, it will not be there because opposite force will be there from the ground. So, but wherever there is dependency, they will look very very higher. And even in case of bony prominences, buttocks, neck area, etc., etc., you will not see them very very predominantly. Rather, where only in the dependent part it will be appearing. And also usually the time it has to appear is 1 to 3 hours of the death initially. If it looks like a mottled patches, there, okay, there and there you will be seeing the patches. Later what happens, they will increase in the size in many areas. Then what happens, they will start uh, uh, combining together, one patch another patch, they start combining together. So this is in a matter of 3 to 6 hours. So again, 1, 2, 3. So that is how the process of death occurs. So usually initial 2 to 3 hours, later is 3 to 6 hours, later is 6 to 12 hours. So that hour you have to remember. So in 3 to 6 hours, what happens? They again widen and they become fully developed. And later in 6 to 12 hours or 6 to 8 hours, what happens? They become fixed. So that is called as the fixation of the postmortem lividity. So this fixation is very very important again to estimate the time of the death. Okay. Initially before 8 hours, if you are going to give some pressure, then the postmortem lividity will change. Okay, if you are giving the pressure this side, that postmortem lividity may go that side. But after 8 hours, what happens? It becomes fixed, and whatever you do, they may not actually change the position. So that is very very important. Of course, in some of the forensic experts don't give much priority to this particular fixation. It depends on their experience. But one thing, what is there in the text, we have to record or we have to write it down in the examination. And the color of the postmortem lividity, already as I told you, it will be purplish in the color. However, it depends even on the cause of the death. Uh, next is next is about the postmortem lividity, which is seen in the viscera also, not only on the skin, even in the viscera also it will be seen. So, for example, in the posterior portions of the cerebral lobes, cerebellum, and posterior surface of the heart, lung, liver, kidneys, spleen, larynx, stomach, and intestines also it will appear. And hypostasis in the but one thing what happens here is, whenever this hypostasis is appearing, it may also look like something else, okay, some other pathology. So many times the forensic expert may get confused. Like for example, if at all hypostasis is seen in the heart, then he may think it may be myocardial infarction. So that thing, some confusions may occur because of this hypostasis. So one thing is, as we already know, time since death can be estimated. Position of the deceased at the time of the death also can be established, and it can establish the cause of the death also, because color may change as per the cause, right? And also it may be mistaken for the contusion or some other pathology. So one should be very cautious before he records about this particular postmortem lividity. Some alternate whatever thing might have happened as a pathology, that also has to be noted down. Next, about the changes in the muscles. So you have three things here. We have to write it, very important. Very important area is the rigor mortis here. Primary relaxation, rigor mortis, and secondary relaxation. Primary relaxation is also called flaccidity. The middle part is very stiffness. The last part is again flaccidity or relaxation. So in the primary relaxation, you have certain things happening. For example, there will be drooping of the lower jaw, eyeballs also will lose the tension, pupils will be dilated, flabby joints will be there. So it is something which occurs in the immediate and the early stages of the death. So it is a combination of both immediate as well as the early changes. So rigor mortis and the secondary relaxation follows on this particular primary relaxation. So immediately after the change, what happens? Because brain is not functioning, the muscle also, whatever control is there of the brain on the muscle is lost. So what happens? The muscle starts relaxing because it doesn't have any controller. So it becomes relaxed. So there will be pupillary dilatation, sphincteric relaxation, urinary and stool incontinence, isn't it? Many a times in the dead body, you are going to see some urine and the fecal matter also, which has been released. That is because of this primary flaccidity. So this primary flaccidity comes in the immediate change only. Okay, it is nothing but midway immediate changes, starting of the early changes we can consider that. And rigor mortis, typically the change in the early changes. So it is the postmortem stiffening, okay, or rigidity what occurs as in the muscles, a group of muscles usually. What happens is here there will be the group of muscle is going to become stiff, and it occurs both in involuntary and voluntary muscles. Again, it depends on the time of onset. For example, temperate climate, it is 3 to 6 hours. In tropical climate, it will be bit early, that is 1 to 2 hours. So there is a big mechanism for the rigor mortis or RM. So the first, you can write a big note of it, but at least you have to mention that it is because of two contractile elements, especially the proteins of the muscles, that is actin and myosin. So you know that muscle, you have already studied the physiology, right? So in muscle, what happens? The fibers are there. So each muscle fiber will be having both actin and myosin. So what happens to this particular muscle? There is the activity is generated. Whatever the activity occurs in the muscle, it is generated because of the adenosine triphosphate. That is ATP reserve from the muscle. So here, this is nothing but directly it is in relation with the ATPs only. Okay. So So, very important thing here in this particular slide is, of course, you write the mechanism. You may be very much elaborately writing it if you want a good mark. At least one or two things, one or two line you write, that itself will tell us that you have understood the matter perfectly. Very important thing here to analyze is when it starts, which muscle it is affecting. Okay, how it starts. So, muscle of eyelids, face, jaw, gradually to the larger muscle. So, initially for the smaller muscle, later to the other, that order will be followed. That order will be followed, and similarly, when it is passing off to the flaccidity also, it will follow the similar order. Next one is the secondary flaccidity. Here what happens? So secondary flaccidity, rigor mortis, again a stage in the early change. But the secondary flaccidity is again after early change, but prior to the decomposition. So here some you can understand it something which is having some relation with the molecular death. So molecular death, somatic death is the first stage. Second stage is the molecular death. So here molecular death stage is nothing but a secondary relaxation. This is also similarly in the same sequence like how the RM or rigor mortis is occurring. First is the slow, sorry, first is the small group of muscles, later comes to the larger group of the muscles. So ultimately what we have to understand is rule of 12 hours rule. Okay, for everything, the muscle total changes what occurs, especially the rigor mortis and the secondary flash. It takes 12 hours to develop and 12 to maintain. The rigor mortis stage will be maintained for 12 hours. And after that, next 12 hours, what happens? The rigor mortis will vanish and it becomes, slowly it becomes flaccid or secondary relaxation will occur. So initially, the from the stage of primary relaxation, uh, slowly developing from the smaller to the larger muscles. So 12 hours it will take. Later 12 hours it will maintain. Later 12 hours it will disappear, making the all muscles relaxed. So in that way, the rule of 12 has to be understood here. You can write it down also. You can also mention about different factors. Okay, this can be asked even as a short essay, right? So you can have a small note also, like what is rigor mortis, definition of rigor mortis, and how it occurs, mechanism, and also you may have to write the factors like disease, different disease conditions, health conditions, age conditions, temperature, and eye, heart, skin, etc., etc. Okay, so these factors you can mention. Similarly, you have to mention the medico-legal importance. For example, once rigor mortis has set in, it is nothing but a reliable sign of the death. It gives information of the body about the position and time of the death, and also the color. The color of that particular rigor mortis will suggest the cause of the death as well, because discoloration, if at all it is there along with the rigor mortis, it also gives you the manner of the death. So in that way, there will be some medico-legal importance to this rigor mortis. Now let us go on to the late changes. So these changes can be asked as mention about the immediate defined death, confirm the test, and also you give the modes of the death and you write about the immediate death. So that may be one question, or it can be the other way. All initial questions the same. You may be asked about the later changes. So it depends, what is the questions you have to answer. Either it is immediate or else early or else late changes. In late changes, what happens? It is after the 24 hours. After the 24 hours, what changes occurs as a chain of events is called as late changes. Here what happens? The main thing what happens is putrefaction. Putrefaction is something called as decomposition, or wherein the body is going to decompose. And why the decomposition occurs? So that it goes to the step called as, or appearance called as, skeletonization. So decomposition, which will turn the body into the skeletonization. Many times what happens, putrefaction doesn't appear at all. Instead of it, the other two stages may happen. For some bodies, adipocere formation can occur. For some bodies, mummification can occur. So adipocere formation and mummification is nothing but modification of the putrefaction. So either the body has to get putrefied and go for the skeletonization. If not, if modified, the body will go to the adipocere formation depending on the atmosphere, water content, etc., etc., fat content, etc., etc. Or else it may go for the mummification, wherein the water is not at all there in the body. It is totally dehydrated. So the presence of water or moisture and its absence matters for the modification of the putrefaction. So putrefaction, as we have already told, it is nothing but the decomposition, and it is a final process of the cadaver. So here what happens is actually the bacterial fermentation. So soon after 3 to 4 hours of the death, up to 2 to 3 days, it will start to continue. So along with the early changes, so whatever early changes is happening, along with that only the first stage will set in, and it will continue up to 2 to 3 days. So it will be very high when it comes to comes to after 24 hours. So here putrefaction is because of the bacterial action. Bacteria is very, very important, and certain bacteria, especially lecithinase, capable of bringing of lysis of the skin, lysis of the tissues, total tissues. So this lecithinase is nothing but the enzyme, like proteolytic enzymes or any other similar enzymes also come into the gathering or come into the action, and these enzymes are brought into the surface because of action of different bacteria, and the different bacteria, to name some, it is staphylococcus, proteus, and E. coli, clostridium welchi, etc., etc. So all these in overall anaerobic and aerobic, and moisture is very important, and decrease in the tissue oxygen level is very important. Certain atmospheric temperature is very, very important. So ultimately what happens, because of all this fermentation action, etc., etc., the thing will change into gas, liquid, and salt. So ultimately the organic matter is converted into the inorganic matter, especially the bones, until they also crumble and they also become inorganic dust over the matter of time. So organic thing converting into the inorganic thing, that is nothing but decomposition, and this all happens because of the bacteria only. So that you can write down in elaboration, and you can write about what happens during the putrefaction, like three changes: external changes, colliquative putrefactive changes, and internal changes. So external changes means again skin changes, marbling of the skin, foul smelling of the gases, appearance of the maggots. Now what happens in the external changes, especially with the specific to the skin, means some greenish color will appear in the skin, and that is because of sulf-methyl-hemoglobin, which is actually formed in the intestines. So this lysis of the RBCs will release the hemoglobin, and in turn combination of the hydrogen sulfides which will be there in the intestine, they also come together, and they will impart the greenish bluish, greenish blackish in the color, whatever the color is appearing. Okay, so see, it is, this slide tells you some story about this green discoloration. And site is also very important, like it is on the abdomen of the right iliac fossa. Later it will go on in the different areas, etc., etc. So ultimately the face, neck, thorax, shoulders, arms, and abdomen, legs, everywhere you can find it. And next set of changes after the skin changes is nothing but again skin only. This is also skin only, but that was very specific to the color change, like what happened, green color. And here it is marbling. Marbling means what? Marbling is the discoloration which occurs in the vessel, not in the skin. Not only in the skin, however, it has occurred. Now what happens, the vessel walls are also discolored, and because of that what happens, the pigmentation will be looking over on the skin. So it looks as if some marble like arborescent pattern, that vessels will look very, very prominent, okay, with a greenish color. So that will appear, and that is how it is called as marbling. So this is how it is noted down. The pic is telling you again of the story of marbling. So next step is the foul smelling. So you know that when how putrefaction occurs, because of the smell. Usually, bodies are many a times understood as dead because of the smell only, right? So the smell is very very important. Again, it is because of the bacteria, the combination, especially ammonia gases, phosphated oxygen, and also hydrogen, and also the methane. So all these are very very important, and this placement of the gas inside the body, it also gives some pressure to the wall's surface. Okay, and because of that, what happens, that there may be some bloating of the total. Because of the gas, the body will float, and there will be some extrusion of the fluid from the mouth, nose initially. There will be some, many a times the abdomen etc may open, genitals etc may open up because of the pressure which is exerted on that particular area, and the fluid may go out also. So there will be shifting of the fluid also from internal to external. And similarly, during this particular course only, there will be, because fluid is there, right? So fluid is very important. The heat is there, fluid is there, atmosphere is also very comfortable. So here what happens, there is the flies, entry of the flies, they starting, because atmosphere is very nice, environment is very helpful, they start laying the eggs on the decomposed body. So usually nose, mouth, vagina, anus, so wherever there is a opening, usually they lie down in 18 to 36 hours, and after to 20 after this 36 hours maybe, they are going to hatch into the larvae or the maggots, and they destroy all these maggots. What they do, they are very very voracious eaters there. So they start eating because they want something, no, for food, as food. So they start using the tissues already which is exposed out, because gas had given some pressure, all tissues are exposed out. So they start eating all these tissues, and 4 to 5 days around they develop into the pupae, and again as a adult fly around 7 to 8 days. So this is a very a nice process which is studied in the forensic entomology. The flies, what different types of the flies, and the time of laying their eggs, and turning into the larvae, and larvae to pupae, and pupae to maggots to pupae, and pupae to flies. So all these, whatever the life cycle is there, it is also going to tell you the story about the time since the death. So the estimation of time is again helpful. So there is a pic here, how the flies are entering into the open area orifices. Apart from that, teeth, all of the teeth will fall down. There will be separation of the skull, and the brain matter will also start oozing out. So all this is called as colliquative putrefaction. So this occurs between 7 to 14 days. Some internal changes also will occur inside, like different organs are affected, especially in the stomach, it becomes dark red over all the this thing walls. And as I already told, the exertion of the gases will be there, so perforation also will be there. And liver will be foamy liver it is called. So in that way, the internal changes also you can mention. So overall, early putrefaction and late putrefaction. Early in the sense 24 to 48 hours, and late in the sense 2 to 3 weeks. So depends again on the different organs as well. Even other factors like age, sex, etc. also you can consider. And factors which are modifying the putrefaction, here you can take it as external and internal. So external in the sense warmth and clothing, moisture, etc. Internal in the sense age, condition of the body, sex, mode of death, etc. You can explain well. So after all this, like decomposition, what is the ultimate thing? What occurs is skeletonization. Skeletonization is nothing but the bony tissue remaining. All non-bony tissues are going away from the body. So the total skeleton is looking, and this skeleton again it depends on the conditions. It can stay for a longer time, several years it can stay, or that also can decompose. That also can decompose depending on the condition where it is placed. And rate of the skeletonization, etc. Also that also will give you the time of the death. Okay, for example, where the body is. For example, in neutral pH soil or sand and all, the skeleton will persist for several thousand years before it disintegrates. So depending on where it is placed, the skeleton also give you some idea, like when the death might have occurred. Like it may also turn into the fossil. For example, if at all it is in some area maybe very deeper in the ground, then it can also turn into the fossilization. So that may be persistent for millions of years. So this is a pic of the skeleton. And modifications, we will now explain about the modifications. So this individually may come as an question, or else it can be a part of a question where you have to explain the late changes of the death. Adipocere. So adipocere is nothing but a modification of the process of putrefaction. Here what happens? It is nothing but hydrolyzation of the fatty tissues into the fatty acids. So it is converting into the fatty acids. Again, what happens here? Bacterial fat splitting enzymes and moisture is important. Like whatever lecithin we had discussed in case of the putrefaction, that is also very important. At the same time, some moisture is important. Fatty acids are very fatty. Hydrolyzation occurs of the fatty things which may be there prevalent in the body. So it turns into the fatty acids. Different fatty acids it occurs, and that appears as yellowish white greasy wax. Okay, and with rancid smell also it will be there. And in summer it may take around 3 weeks, and in tropics it may take around 5 to 15 days. Important thing is, whenever this adipocere formation occurs, the body will retain its form, the features. So this helps for the identification. Similarly, cause of death, the time of the death, place of death, etc. will be mentioned. This is a pic of the adipocere. It is easy to identify whether it is male, female, or maybe a young person or an old person, etc. Some idea will be there. Another type of modification what occurs is because of the water content which is lost. It is evaporated, making the body dehydrated or desiccated or shriveled up. So here also the natural appearance and features of the body will be retained, so you can identify the person. So here dry placement is very, very important. For example, the body buried in the sandy soil, soft parts become desiccated and the putrefaction is inhibited. So overall, the body is looking hard, dry, leathery mass, and the features will remain as they are. Several weeks may occur before they go for the mummification. So in this way, mummification is also having certain medico-legal significance, wherein it will help in the identity as well as the time and cause of the death. And mummy is one of the cultural practices also in certain areas of our world, including Egypt, where the body is mummified because of some natural things, using the natural things, or maybe the area or atmosphere is converted and the body is placed into different types of the caves, etc., or maybe a coffin, etc. So many a times bodies are found dry, desiccated, shriveled. So this is all about the changes of the death, changes of the body after the death, following the death, which which is followed by the definition of the death, different types of the test what will help you to confirm the death, and stages of the death, manner of the death, and causes of the death, modes of the death, and changes of the changes what occurs following the death, including immediate changes and the early changes and the late changes. So I hope you will do well in your examinations. So the thanatology is not only very specific from the point of crime identification. There are many other purposes also. So very specifically, we have discussed the forensic thanatology. Later, autopsy and the transplantation of the organ tissue. Okay, that act is also to be discussed, which is there as another part in this particular chapter. So, if time permits, we will take up in the further classes. And thanks for the opportunity, Panchajanya. And I really wish everybody come out with a good marks and contribute a lot to Ayurveda and this particular Agada Tantra. Thank you.
Thank you, ma'am. It was very interesting session. Firstly, thank you for accepting our invitation to take up the session. It was very interesting, ma'am. I'm sure many are benefited from today's session. Thank you, ma'am.
Thank you. Shall I leave?